Welcome to 805 Focus. I'm Dr. Cynder Sinclair with Nonprofit Connect, and we will be bringing you the latest on your favorite nonprofits. So get ready to be inspired. Our special guest today is Alana Walczek, and Alana is President and CEO of Calm. Welcome, Alana.
Hi, Cynder. Thanks so much for having me.
Thanks for being here. I'm very excited to talk about your wonderful organization. You folks are so important and do such good work that affects people for generations upon generations.
Absolutely.
Yes. So give us a little sort of basic information. We'll just build from that about Calm.
Well, I'll start at the beginning. We were founded in 1970, so we're about 54 years old now. We serve the entirety of Santa Barbara County. We have about 85 staff. This next year, just shy of a $10 million budget. And our mission is to prevent childhood trauma, to heal children and families, and to build resilient communities throughout Santa Barbara County.
I love that. So that's your mission.
That's our mission. And so what that means is we're preventing trauma, and I think trauma gets used a whole lot in common conversation these days, but when we're talking about trauma, we really mean an incident or a series of incidents that interrupt someone's functioning, their ability to cope, their ability to get through the day. And we primarily focus on children. So the traumas that children may be experiencing might be abuse or neglect, or living in a household where there's domestic violence, or a parent with a mental illness or a substance abuse disorder, anything that interrupts that connection between caregiver and child. So our work is really to prevent those incidences from happening, loading up a family with resources and education and support, or providing early intervention if something has been identified, or providing long-lasting treatment to support that family in those times of distress.
That's so important. So
it really is.
How do you find out about these children?
We get referrals from all different sources. I'm happy to say that many referrals come directly from the family themselves. They've heard of our reputation, they've heard of our good work from a friend, from another family member, from a colleague, and so they will reach out and call us directly. We also get referrals from preschool teachers, elementary school teachers, doctors, nurses, really any professional that works with children and families. We partner with about 75 different organizations across the county. So we really try to work in partnership, in network with them, so that any child or family that needs support can get connected to Calm.
Wow, that's 75. You really collaborate.
We really do. I mean, when you're trying to move the needle on something as big as interrupting the intergenerational cycle of trauma, you can't do that alone, and Calm can't do that within our own walls. Of course, we provide therapeutic services at Calm's 3 clinics across the county, but we also have to partner with the medical community. We also have to partner with the educational community. We also have to partner with the justice community. Anyone who's working with families, we want to partner with them so that services are easily accessible and that we can find families, at any point in their journey.
Yeah, and so you were talking earlier about how you partner with the medical facility or facilities with like ACEs and.
Yeah,
tell us about how you do that.
ACEs is an acronym that stands for Adverse Childhood Experiences. And so we're working with 7 different pediatric clinics at this point, where the physicians and their staff are screening for those adverse childhood experiences, those early traumas, stressors. And there's been so much research that shows that the more ACEs a child experiences during childhood, the more likely they will have negative emotional health outcomes as well as physical health outcomes later in life. And ACEs are very common. So ACEs are things like I was sharing earlier. It could be physical, emotional, or sexual abuse. It might be physical or emotional neglect, exposure to domestic violence, death of a parent, divorce, anything that might jeopardize the connection between parent and child or the well-being of that household. So we partner with pediatricians now when families come in with their little itty-bitty babies. So at those well baby visits, we're screening to find out if those infants have had any traumas early in their life, or if their parents have had childhood traumas themselves. Because if so, that is definitely going to potentially interrupt their ability to have really strong parenting connections. So when those physicians, when those pediatricians who are trusted advisors to those families, so it really works well. Families have this newborn, they want to do everything possible to raise that baby well. So they're doing these screenings for these stressors with their pediatrician, and depending on how many stressors are identified, referrals come to CALM for therapeutic support services. So it's really been a tremendous partnership, transitioning the way pediatric medical care is provided and really helping families understand the long-term impacts of trauma.
Right, because on your website it talks about breaking that intergenerational cycle of trauma. So tell us about that, how you do it, but why it's important. And I'm also curious, speaking of breaking the cycle, let's just say a pediatrician sees a baby or a young child and calls into your office or refers the person to you. And have you ever had like the parents get all upset, like, what are you talking about? No, my child is perfect.
Actually, we don't really have that experience. And again, in that situation, families are coming to their regularly scheduled well baby checks. So at 3 months, at 6 months. So they're seeing their pediatrician at those regular intervals. So the nice thing about the way this works is it's integrated in with our partnering pediatricians. And we can interrupt the intergenerational cycle of trauma. Trauma, unfortunately, gets passed down from parent to child because, as you know, babies don't come with manuals. So we only know how to parent typically based on how we were parented. Yeah. And if we had unhealthy parenting, we're likely to pass that forward. So what we're trying to do is wrap our arms around these families if there are risk factors identified, to really help provide support. And if we can support a parent right then and there when they have an infant to understand their own childhood trauma, they may change their parenting for that baby so that that baby, when he or she grows up, may be able to parent in an entirely different way. And so we always believe that at any point in a family's trajectory, we can intervene and interrupt these passages of trauma, because you can also pass down resiliency. So that's what we're trying to do. We're trying to transition families, if there is trauma, to learn healthier coping skills, to heal. This is part of our treatment work, so that those children can then grow up to be healthy adults and healthy parents. So it's really quite powerful. It's really quite powerful.
Very powerful. Talk about affecting generations.
Yeah, I mean, if we can do right by the 8-year-old or the 18-year-old, so that they can grow up and be healthy adults, that's transforming their life and their family, future generations, and our community, because it means that we will have healthier families, healthier employees, all of those things. So we take it really seriously.
Yes, thankfully. And so I can imagine maybe some parents don't even realize that they had childhood trauma, or they have potentially bad parenting skills.
Yeah,
and
they only know what they know.
Right. And so for you to, first of all, help them identify that, and second, then help them to learn a better way.
You asked before, do we have parents who say, no, not me? We've had actually the opposite, where parents have thanked their pediatrician for asking the questions. That no one had ever asked them about these experiences, and it was an opening. And what we've learned from the pediatricians is it changes the medical relationship between patient and doctor. There's a new level of trust, and more gets discussed. And the more information that gets shared, the more we can address whatever's going on. And so the therapeutic work obviously doesn't happen there in the pediatric office. That's where it gets connected to CALM, and we can provide that long-lasting support. But parents actually really have been thankful to have these questions asked of them and to be connected to services.
That's great. I'm so glad to know that. So I also read on your website, yet again.
Thanks for reading.
Oh, yes. What did you say? Evidence-based services. Tell me what that means.
Yeah, so we have a continuum of care, starting with prevention and early intervention, but then also treatment. And so we're using evidence-based modalities, meaning that they have been studied, they've been researched, and there's evidence behind them verifying that they are effective for the treatment of trauma. And so this is really important that each modality that we are using at CALM has this research backing, and we make sure that our clinicians are providing those services with fidelity to the model, making sure that we're doing exactly as the modality requires. And we're continuously training and discussing all of our clinical work. So it's really important to know that for the community to know that clinical excellence is one of the key foundational elements of CALM. And so we are using these evidence-based modalities. And I'm pleased to say that in the last year and a half, we've now added 2 new modalities to our repertoire. Most recently, we received a grant to initiate a program called Child-Parent Psychotherapy. And this is for the littlest of the littles. It's for children under age 5 to provide dyadic therapy, meaning together, parent and child, or caregiver and child. And it's very rare to be providing therapeutic support for children this young, but we're going to be bringing on an entire cohort and building the infrastructure within our organization to be providing this modality throughout the county. And at that age, for the littles, it's really about building the connection to the caregiver, building attachment and attunement so that that child has that safe home base with their parent or their caregiver. So we're really excited about that, to be able to add this therapeutic modality specifically for children under age 5.
So let's just say I'm a parent of a young child. I'm watching this and I'm thinking, gosh, my child is not, it just has some strange behaviors. And I'm wondering if maybe something has happened, or maybe it's just a normal phase of childhood development. Should I do something? Should I not do something? Am I overreacting? Am I not paying close enough attention? What advice do you have for someone in that
I
place?
think any community member can always call CALM, whether there's been trauma or not, even if it's a situation that we can't take into our client caseload, we can provide resources and referrals. I will say that, child development, there are markers along the way, along an age continuum, and when there are delays or when there are differences, sometimes that can lead, unfortunately, to a parent not understanding, getting frustrated, and it might lead to a negative dynamic between parent and child. So there's room for that work. We provide a modality, it's called parent-child interaction therapy, for children and parents who've kind of gotten into a negative cycle where it's a lot of don't do that, stop this. And those families can get referred to CALM, those parents can come in. It's a really interesting modality where the therapist wears an earbud and the parent wears an earbud, and the therapist is behind a one-way mirror. The child knows that that therapist is there, but this is for children under the age of 7. They forget. And throughout the therapy, the therapist is coaching mom or coaching dad in real time with their child, learning how to play, learning how to communicate, and really shifting that negative interaction into a positive one. And so we've seen in a fairly short amount of time, 3, 4, 5 months, some really transformational movement in the relationships between parents and children where there have been concerns, where there have been behaviors. So I think it's always good for a parent to reach out, whether it's to calm or maybe talking about it with their school, with a teacher, to get more information, talking about it with the pediatrician. We are now partnering with 15 different preschools.
Oh.
So that's also an area for connection that might be possible. But we want parents to get support in whatever way from the community.
So no wonder that Calm was given the Nonprofit of the Year award.
Yes, we were so overwhelmed. We received a call from Assemblymember Greg Hart, who selected Calm this year as Nonprofit of the Year from his district. I went to Sacramento to accept the award on behalf of all of our staff, all of our board members, all of our supporters, and most especially all of our clients who do the really difficult work of healing from trauma every day. But it really was a feather in our cap, I would say, because there are 120 legislators. And so there were this year 117 nonprofits recognized out of more than 200,000 in the state. So to be a part of that small group really, really felt special. And I think in talking to Assemblymember Hart, what he said was just that he was really impressed with both how Calm is run, the administrative side of things, the organization of the agency, but obviously of the impact of our clinical services, especially after the pandemic when we're seeing such an increase in mental health needs of children and families. So it was really quite the honor, and we're very proud to have received it.
Yeah, you're having such an impact in this community, and that's really the best way to measure the value of any nonprofit. So congratulations.
Thank you. Thank you.
And so Calm is a 501c3 nonprofit, right?
We are.
So I'll bet a person can go on your website and there'll be a Donate Now button.
Absolutely, there is.
Make a tax-deductible donation.
Yes.
And know that it's going to be very well spent or used.
We're very pleased to have such broad community support, and it's always just individuals in this community who will never know necessarily the children or the families that we're serving, but who want to contribute, who want to support the healing and the recovery of the most vulnerable and the prevention of trauma in families where there are risk factors. So it always amazes me that the community steps forward to invest in our services, and we're just so grateful. But yes, people can just click on our website and they'll find a way to do that.
And so while they're on the website, they can also look at, I bet you have fundraising events. I know you have one, coming up, you have one in the fall. And tell me how that works with serving the whole county.
Yeah, so we have a fundraising event called Calm at Heart every fall here in Santa Barbara. And then we have a sister event in Santa Maria every spring called Let's Get Loud.
Okay.
And so at different times of the year on our website, folks can learn about whichever event is coming up, how they could sponsor, how they can attend. But both events, of course, raise money to support our mission. But we also take it very, very seriously that they're educational opportunities where we're really teaching the community, sharing more about the work, about the clinical impact we're having on children and families so that we can spread that message.
So at the actual event, that's great. That's a great way to use those events too.
Yeah, well, we want our events to be mission focused.
Yes.
So we want to make sure we're always telling the story of what we're doing.
Well, I appreciate you coming, telling us your story today.
Absolutely.
And we appreciate all the wonderful work that you're doing.
Thank you. It feels such an honor, truly, to be part of an organization changing so many lives. So thank you for having me, and thanks for your support.
Yep, thank you. And thank you for joining us on 805 Focus, and we'll see you next time.